Introduction. What if I told you that something as simple as not brushing your teeth tonight could triple your risk of developing one of the deadliest cancers known to medicine? Stay with me because what you're about to discover will change how you think about your morning routine forever. Welcome back to Health Frontiers, the podcast where cutting-edge science meets everyday wellness. I'm your host, and I want to personally thank each and every one of you incredible listeners who've subscribed to our channel, shared our episodes, and trusted us to bring you the latest breakthroughs in medical research. Your engagement and curiosity fuel our mission to translate complex science into actionable insights that can transform lives. Before we dive into today's groundbreaking discovery, I have a sincere request. If this episode provides value to your life or someone you care about, please consider sharing it. Knowledge shared is knowledge multiplied, and together we're building a community committed to better health through better understanding. Today, we're exploring a remarkable study published in JAMA Oncology that has sent shockwaves through the medical community. Researchers at NYU School of Medicine have uncovered a startling connection between the bacteria and fungi living in your mouth and pancreatic cancer, often called the silent killer of cancers. This isn't just another correlation study. This is the largest investigation of its kind involving 900 American participants followed for 9 years, and the findings could revolutionize how we approach cancer prevention. Part 1. The Silent Killer Revealed. Let's begin with a sobering reality check. Pancreatic cancer kills just over 10,000 patients every year. That's approximately 1 death every hour. By 2040, experts predict cases will hit record highs, with 201,000 diagnoses expected. These aren't just statistics. They represent families, dreams cut short, and a medical challenge that has long frustrated the brightest minds in oncology. What makes pancreatic cancer particularly insidious is its stealth nature. Unlike other cancers that might announce themselves with obvious symptoms, pancreatic cancer whispers until it screams. When caught early, before spreading throughout the body, around half of patients survive at least a year. But here's the crushing reality. For the majority of patients where cancer has already spread beyond the organ, only 1 in 10 will survive. The warning signs are deceptively subtle and easily mistaken for common ailments. Jaundice that turns the whites of your eyes and skin yellow, itchy skin, and darker urine. These symptoms often appear when it's already too late for optimal intervention. Perhaps most concerning is an emerging trend that has oncologists worldwide scratching their heads. Since the 1990s, rates of pancreatic cancer in women under 25 have soared by up to 200%. While the absolute numbers remain low, this frightening explosion, as highlighted by medical journals, shows no parallel increase in men of the same age group. Overall, Britain has seen a 17% increase in pancreatic cancer incidences, with obesity rates and environmental factors suspected as contributors. But what if the answer to this mystery has been hiding in plain sight, right inside our mouths every single day? What if the key to prevention isn't found in expensive treatments or complex medical procedures, but in something as fundamental as oral hygiene? This brings us to the revolutionary research that's changing everything we thought we knew about pancreatic cancer risk factors. Part 2. The Mouth Cancer Connection Breakthrough. The human mouth hosts an entire ecosystem, a complex community of bacteria and fungi known as the oral microbiome. For years, medical experts suspected that poor oral hygiene created vulnerabilities to various diseases, including cancer. But until now, we lacked concrete evidence identifying which specific microorganisms posed the greatest threats. Dr. Richard Hayes, an expert in population health and co-author of this groundbreaking study, and stated with remarkable clarity, "It is clearer than ever that brushing and flossing your teeth may not only help prevent periodontal disease, but may also protect against cancer. The research team at NYU School of Medicine embarked on the largest study of its kind, examining data from two prestigious ongoing investigations, the American Cancer Society Cancer Prevention Study 2 and the Prostate, Lung, Colorectal, and Ovarian Cancer Screening Trial. These weren't small-scale observations. This was comprehensive, long-term scientific investigation involving 900 American participants. Here's how the study unfolded. At the beginning, participants rinsed with mouthwash and provided saliva samples, a simple procedure that would unlock profound insights. Researchers then followed these individuals for approximately 9 years, meticulously recording any presence of cancerous tumors. The comparison phase revealed the study's most significant findings. Researchers analyzed bacterial and fungal DNA from saliva samples of 445 pancreatic cancer patients against 445 randomly selected cancer-free participants. After accounting for known confounding factors such as smoking, age, and race, they identified 24 specific species of bacteria and fungi that either dramatically increased or significantly reduced pancreatic cancer risk. Yi-Sun Meng, PhD, the study's lead author, emphasized the significance. Our findings provide new insight into the relationship between the oral microbiome and pancreatic cancer. But the most shocking discovery was yet to come. For the first time in medical literature, researchers identified a type of yeast called candida, which naturally lives on our skin and throughout our bodies, as playing a potential role in pancreatic cancer development. Additionally, 3 bacteria linked to the cancer were already known culprits behind periodontal disease, a nasty gum infection that can literally eat away at jawbone and soft tissue surrounding teeth. The mechanism appears elegantly simple, yet terrifying. Harmful bugs originating in the mouth travel via saliva into the pancreas, potentially triggering cancerous changes. It's a journey measured in inches that can have life or death consequences.
Part 3. The numbers that could save your life. Now comes the data that should make every listener reach for their toothbrush immediately. The entire group of harmful microbes identified in this study increased the risk of developing pancreatic cancer by more than 3-fold. Let that sink in. A 3 times greater likelihood of developing one of medicine's most deadly cancers, potentially influenced by oral hygiene practices we control daily. This isn't just academic research gathering dust on library shelves. The practical applications are immediate and profound. By assessing the makeup of each participant's oral microbiome, researchers successfully developed a tool that could estimate individual cancer risk. Professor Jiang An, study co-author, explained the clinical potential. By profiling bacterial and fungal populations in the mouth, oncologists may be able to flag those most in need of pancreatic cancer screening. Imagine walking into your dentist's office for a routine cleaning and walking out with potentially life-saving information about your cancer risk. This isn't science fiction. This is the future of preventative medicine, and it's arriving faster than many anticipated. However, the researchers maintain scientific integrity by emphasizing an important distinction. Their findings cannot yet confirm a direct cause and effect relationship, but rather demonstrate a significant correlation between cancer risk and certain mouth-dwelling microbes. This distinction matters because it guides how we interpret and apply these findings while further research continues. The research team isn't stopping here. They're expanding their investigation to explore whether oral viruses, such as those causing oral thrush, might contribute to cancer development. They're also examining how the mouse microbiome could affect a patient's prognosis after diagnosis, potentially informing treatment strategies and improving outcomes. What makes this research particularly compelling is its foundation in long-term, large-scale observation. This isn't a small study with questionable methodology. This is robust science, published in JAMA Oncology, one of the most respected medical journals in the world. The 9-year follow-up period provides the kind of longitudinal data that strengthens confidence in the findings. Consider the broader implications. If oral microbiome profiling becomes standard practice, we could identify high-risk individuals decades before symptoms appear. Early intervention strategies could be implemented, screening protocols could be personalized, and prevention efforts could be targeted with unprecedented precision. The beauty of this discovery lies not just in its scientific significance, but in its accessibility. Unlike many medical breakthroughs that require expensive technologies or complex procedures, improving oral hygiene is within everyone's reach. The tools for potentially reducing pancreatic cancer risk are already in most people's bathrooms.
Part 4. Transforming knowledge into life-saving actions. The question now becomes, how do we translate this groundbreaking research into practical, daily actions that could save lives? The answer begins with fundamentally reimagining oral hygiene from a mere cosmetic routine to a critical component of cancer prevention strategy. First, let's establish what optimal oral hygiene looks like in light of these findings. Brushing twice daily isn't just about fresh breath and white teeth. It's about managing a microbial ecosystem that could influence your long-term survival. The mechanical action of brushing disrupts bacterial biofilms, preventing harmful species from establishing the kind of dominance that might contribute to cancer risk. Flossing takes on new significance when viewed through this lens. Those hard-to-reach spaces between teeth aren't just hiding food particles, they're potential sanctuaries for the specific bacteria identified in the study as cancer-promoting. Daily flossing becomes a targeted strike against microorganisms that could be planning a much longer journey than just to your gums. Regular dental cleanings and checkups assume greater importance beyond cavity prevention. Dental professionals can identify and address periodontal disease. Remember, 3 of the cancer-linked bacteria identified in the study cause this very condition. Professional cleanings remove bacterial accumulations that home care might miss, essentially performing cancer risk reduction services. Mouthwash selection could become more strategic. While the study participants used mouthwash for sample collection, certain antimicrobial mouthwashes might help manage harmful bacterial populations. However, it's crucial to maintain balance. Completely sterilizing the mouth isn't the goal, as beneficial bacteria also play important roles. Lifestyle factors beyond oral hygiene deserve attention. The study controlled for smoking, age, and race, but other factors like diet, stress management, and overall immune health likely influence oral microbiome composition. A diet rich in fiber, probiotics, and anti-inflammatory foods might support beneficial bacterial populations while discouraging harmful ones. Consider the broader health connections. Periodontal disease has already been linked to heart disease, diabetes, and other systemic conditions. This pancreatic cancer research adds another compelling reason to prioritize oral health as integral to overall wellness rather than an isolated concern. For healthcare providers, these findings suggest new screening protocols and patient education priorities. Routine dental visits could include discussions about cancer risk, particularly for patients showing signs of poor oral health or periodontal disease. The research also highlights the importance of oral health across all age groups. Remember the concerning trend of increased pancreatic cancer rates in young women? While the causes remain unclear, establishing excellent oral hygiene habits early in life could provide protective benefits that compound over decades. Looking forward, we can anticipate exciting developments in personalized medicine.
Oral microbiome testing might become as routine as cholesterol screening, providing individuals with specific information about their bacterial profiles and associated risks. Treatment recommendations could become highly individualized based on each person's unique microbial signature. This research represents more than a scientific breakthrough. It's an empowerment opportunity. For too long, pancreatic cancer has felt like a lottery of genetics and environmental factors beyond our control. While genetics certainly play a role, this study suggests that simple, daily actions might significantly influence our risk profile. The implications extend to public health policy as well. If oral hygiene education can potentially reduce pancreatic cancer rates, the cost-effectiveness of comprehensive dental care programs takes on new dimensions. Investing in preventative oral health care could yield dividends in reduced cancer treatment costs and, more importantly, lives saved.
Closing. As we wrap up today's episode, I want to emphasize that the content we've discussed represents cutting-edge research that should complement, not replace, professional medical advice. Always consult with your healthcare providers, including your dentist and physician, about your individual risk factors and appropriate prevention strategies. The beauty of this research lies in its immediate applicability. Tonight, when you brush your teeth, remember that you're not just maintaining oral hygiene, you're potentially engaging in cancer prevention. Every time you floss, you're fighting back against harmful bacteria that could threaten your long-term health. These simple acts, repeated consistently over time, might be among the most powerful tools we have against pancreatic cancer. To our incredible community of listeners, thank you for joining me on this journey through groundbreaking medical research. Your curiosity and commitment to evidence-based health decisions inspire every episode we create. If today's content resonated with you, please share it with friends, family, and anyone who might benefit from understanding this remarkable connection between oral health and cancer prevention. I encourage you to subscribe to Rooted Health Revival if you haven't already. We're committed to bringing you the latest medical breakthroughs translated into actionable insights. Leave us a positive comment sharing how this episode has influenced your perspective on oral health. And let us know what topics you'd like us to explore in future episodes. Remember, small daily actions can have profound long-term consequences. The research we've discussed today suggests that something as simple as improving oral hygiene might be one of the most accessible forms of cancer prevention available to us. Thank you for listening, for learning, and for taking an active role in your health journey. Until next time, keep questioning, keep learning, and keep taking care of yourself and those you love. Medical disclaimer. The information presented in this podcast is for educational purposes only and does not constitute medical advice. Always consult with qualified healthcare professionals regarding your individual health concerns and before making any changes to your healthcare routine. This content should not be used as a substitute for professional medical diagnosis, treatment, or care.